Dear listeners, please listen in to this interview with Ken Connolly from New Jersey Life and Health, who shares an unbiased perspective about educating elders to make more informed decisions on Medicare options. These decisions that can affect their finance and ultimately their health. Please listen in. Thank you. Okay, so welcome, Ken. It's a pleasure to see you again. I know that I've had the privilege of being interviewed by you, so please share with us who you are and what you do.
Yeah, thank you so much, Dr. Guinness. It was great having you on our podcast a week ago. You can check it out. And it's cool to be on the other side of things this time because I'm usually the person asking questions. So thank you for having me. But yeah, so my name is Ken. I am the marketing director and I'm a broker at NJ Life and Health. What we do is we educate people on Medicare and we help them get Medicare plans. It is a family-owned and operated business, but we have helped thousands of people across 24 states. And we do this because we really care. We really work with people so they understand what they're getting, because there is a lot of less than ethical advertising and explanations within the Medicare industry. It is a massive industry. It is an industry worth billions upon billions of dollars, and there are a lot of people fighting for Medicare market share because it is a very big revenue driver for these insurance companies. So what we like to do is, instead of you dealing with a big company, you have a guy or girl that you can trust, that you can call year round, that to the best of their ability is educating you and helping you make an informed decision. And then we also like to advocate and get the word out. We educate people on YouTube. We interview people with our podcast in order to interview people like yourself and estate lawyers and Medicaid experts. And really, even if it's not our particular expertise, we know it's adjacent to our industry and it can help people out. So we're trying to let people know what to look for, what things to kind of keep your guard up about, and really just educate this population because there's a lot of money in it. And a lot of people we feel are misled by Medicare options and advertising and everything like that.
I really appreciate the fact that New Jersey Life and Health has acknowledged the issue at hand with information overload, misinformation, miseducation, and that where communities, elders, seniors are so lost with trying to navigate the system. And and please excuse my judgment or my stance on it because it may be very limited and biased based on those my loved ones who I've helped to get on Medicare and or Medicaid. So I guess my first question is, what are the challenges that seniors experience with Medicare?
Yeah, so I think the first part is the government in many cases expects older adults, seniors, elders, this aging population, they expect them to fully understand an incredibly complex system. So I always tell my clients, people that I talk to, that I had to take a test to relay this information to you, but the government sends them a 100-page book called Medicare and You every year that outlines everything. And it's incredibly complex insurance jargon. There's a lot of regulatory changes, and they really expect people to know everything by themselves when for a lot of people, it's not feasible. It's truly a very overwhelming system. And if you can trim the fat and really cut through what people actually need to know, people can have that aha moment where they really understand everything. But it is a very hard system to undertake for anybody. We're learning stuff every day as a brokerage that has thousands of clients. But if you just expect your aunt who's 65 to open that book, read it front to back, and, oh, I know exactly what I need to do, it's just asking too much of people, in my opinion. The second thing is I think there's a lot of very misleading advertising within this industry. And it's something we've touched on, but there is so much money in specific types of Medicare plans that people are willing to me, it's not so much what's always said that is misleading, it's what's left out. So what I can tell you is when you're watching a commercial and someone says there is a plan that has coverage for extractions, implants, all this major dental work, does that plan cover those things? Yes. what does coverage entail? It may entail $1,000 towards a $10,000 bill. So there is
Oh,
coverage in
right,
quotations, but it's really partial coverage. It's not of that massive dental bill of implants and extractions that could be $10,000. If they're only paying 10% of that, that is technically coverage. And I know I'm beating a
correct.
horse,
Yeah,
but for me, I wish there was a little more transparency where they say partial coverage for these things, because we educate our clients. We really or thoroughly explain all their options. But when you see that commercial 100 times a day, it makes people go, well, why doesn't my plan have that?
right.
Even if you thoroughly given them all the information, because it's just an overwhelming amount of advertising trying to convince you to switch into something that may or may not be best out for your health needs based on benefits.
I think you hit on something really important. It's almost like, and this is part of, again, working to help to convince an audience, a population of a product that you're selling or to change a behavior. So, what I'm
Mhm.
hearing from you is that the behavior the company wants to change, redundant forms and heavy funding to advertise, is to convince them that my plan is the best option. And what I'm also hearing is that it's not misleading per se, but it is it's leaving out, and to some degree misinformation, because if you leave out the nuts and bolts of what is it that they're really signing up for, then it's really them to suffer once they sign up. And I keep on hearing this over and over again with seniors. Actually, as a matter of fact, most of my interviews, when they talk about their struggles with the Medicare and the different Advantage plans, they are at a loss, and it's almost like trial by error.
Mm-hmm.
So, what is it that you do? Walk me through your process. So I come to you. Well, how do we find out who you are? Because
Yeah.
you're down,
So,
you're in South Jersey, yeah, and I'm in
yes.
North Jersey.
Yeah. So when you're 65, let me know. I'll help you out. But yeah, so what happens is someone comes to us, they find us either through a letter, our website, our YouTube videos, whatever it may be, and they come to us. Maybe they're about to turn 65, maybe they're about to retire, maybe they're about to go on Medicare disability, maybe they've heard from us from friends and family. We have a lot of referrals that come to us. But what it always starts with is people come in with their idea of what they think they want and need. And what we do is we hit the brakes and we say, we're going to explain how Medicare works in layman's terms. Give me about 20, 30 minutes. We're going to hit the brakes, because what you think is best for you and what your friends and family have relayed to you may not be 100% accurate, which can be a tough conversation to have with people because you're going against someone's sister, brother, mother, whatever it may be. But a lot of times I find people are getting secondhand information from people who maybe have anecdotal evidence, or they may have been misled themselves. So we come in and we say, here's how Medicare works. Here's how Medicare with the supplement works. Here's how Medicare Advantage works. And usually by the end of that 30 to 60 minute initial conversation, just knowing how each system works leads people to say, this is what's best for me. We know our recommendation tends to be Medicare supplement. It varies greatly depending on your state, zip code, budget, health needs, whatever it may be. So for all of this podcast, I want to say this is very general advice. I'm sure you could find exceptions to everything I say, but in general, we like to recommend a Medicare supplement. But if someone does take an Advantage plan, we like to give them an honest appraisal of what the risks are. Because by and large, and again, there's exceptions to everything, brokers and insurance companies make more money with Advantage plans. It has a higher profit margin in most cases. So in a lot of situations, they want to push these plans. So what they do is they say, here's a plan with dental, vision, over-the-counter cards. Look at all these cool perks. But in New Jersey, a lot of these plans have $6,000, $8,000, $10,000 out-of-pocket maxes. So yeah, you're getting free vitamins, but when something happens, you could have catastrophic medical bills. So we just tell people that. We just say, just so you know, this is how it works. It's nothing per month in most cases. But if something catastrophic like cancer, dialysis happens, you might have very high bills. And that's something that's left out in a lot of Medicare Advantage conversations with other brokers. And I've seen people give the right I shouldn't say right. I've seen people give one way where they give you all the facts, and I
Uh-huh.
see where they leave out, oh, if something catastrophic happens, it might cost you $6, $8, $10,000. So for us, we start with slowing everything down. Your friends, your family, the commercials on TV have told you this. This is how we see things. And let's take a deep breath and let's make sure you fully understand what's going on and that you don't have to read this 100-page book if you don't want to.
So what I'm hearing is elders who are eligible for Medicare get the book, and then you help them to sort of decide what sort of options they have or what should be their best option. But I wanted to go back on a comment that you made, and you say they come to you with what is sort of certain expectations or perception of things. So can you share with me about that?
Yeah, I think the biggest thing is people might have heard secondhand about certain Medicare supplement plans that may or may not be available to them. They might have certain Medicare Advantage plans where they have expectations of what a Medicare Advantage plan is and has. They might also, do you know what a dual eligible plan is by any chance?
No.
So a dual eligible plan is someone who is on both Medicare and Medicaid. They can get a souped up Medicare Advantage plan that has a lot of benefits.
Okay.
And you might say, oh, well, my sister has this plan that's $0 and everything's free. And it's like, well, that works for your sister, but you unfortunately don't qualify for it. Or they have a relative in Florida, which is a totally different situation from New Jersey. So for us, it's level setting that you might have heard this from your friends and family. They might have this in a certain situation, but that might not be your situation. So that's why we start with the basics of how Medicare works, because within that, we can say, here's what your relative has, here's what you're not eligible for, here's what you are eligible for. And it's even sometimes within a couple, the differences are there. Drug costs can vary greatly between people. And I have times where a spouse is paying literally nothing for drugs, and then the other spouse is paying $2,000 a year. Now, it's not that one is getting screwed or anything like that. It's just for their particular health needs, it's a very different situation. So that's what we really cut through is you might have heard this from people, but they're probably 60, 70, 80% there. They don't really understand why they have what they have. So let's explain why they have what they have and why something else might be better for you.
So yesterday I interviewed a social worker, and I asked about their mental health seeking behaviors. So I think I'm going to rephrase that question a little bit in reference to what we're talking about. And what is their Medicare seeking behavior from your experience? Like, how do they go about navigating the system? What have you heard before they get to you?
I think it's a combination. I think as we have a more technologically literate older adult population, I think a lot of people are going on YouTube, Googling things, looking at articles. I think a lot of people do fall back on their communities. You know, where we're at, it's a very retirement home heavy community.
Okay.
I believe Ocean County is the second highest senior population in the country.
Wow.
I have to fact check that, but it's a very densely populated area for older adults.
Mm-hmm.
So a lot of times you're at your retirement clubhouse and you're at your women's club meeting or men's club meeting or whatever it might be. And, you know, you talk to your friends who have been on Medicare for a while. You might talk to your friends and family. But we find a lot of times people come to us either because we've been referred and we're trusted by the people that they reached out to, or they get about 60 to 70% there. They've been looking online, they've been reading pamphlets, they've been watching seminars online, and they throw up their hands and say, I need somebody else to help me out with this because this is overwhelming, which is a very common and it's very common and it's very like understandable that it would be tough for people to process all this information. You know, no one wants to look through insurance contracts and charts and everything like that. So we find it's either someone comes to us, you've been recommended by somebody else, I have no idea about anything Medicare related, or they've done about a little bit of research and they say, I need someone else in my corner. And we can say, okay, you got about 70% there. Let's fill that other 30% so you know that there aren't any issues or anything like that.
So you explain to them the different types of options that are available, and what do I do next after that? And do you all help with the sort of enrollment process That's one question. And the second question is, how are you different from the companies out there that are down advertising and down our throats and pushing this information or misinformation to the communities? Choose me, choose this plan, choose that. So, yeah.
Yeah. So the first part is we guide you through all the government stuff. We can never sign up for you on your behalf, but we can point you in the right direction. I've pointed people online to this is the Medicare application. I've said, here are the forms you need to fill out because you're retiring. So we know step by step what to do 9 times out of 10 when it comes to government related paperwork, because there is a whole portion of just dealing with the government that we help people with because we'd rather you do it in a way that's faster and more efficient. So we do help with the physical government paperwork in terms of just knowing what to expect, where to go, that kind of thing. Again, I can never fill out the paperwork for you, but I can tell you where to go. The second thing that I really believe sets us apart and why we have such a high referral rate is because people are assigned a broker that they know and they trust. It is not a call center. It is not a call center overseas. It is not a big faceless corporation. You get Ken, you get Joe, you get Bill, you get John. You have a person that you know you can call year round to deal with these issues, because even if we explain everything, inevitably people are going to forget or a new situation is going to arise. And I get 3 or 4 calls a day from clients just saying, hey, this happened, a bill got rejected, or why didn't this get covered? And I can very quickly tell you, here's how we're going to go about it to fix it, or I'm going to call your insurance company and see what's happening. So we not only set ourselves apart by being transparent and educating people, but we also are there for life. I've only been doing this for about 4 years. I shouldn't say only, but every single year we touch base with our clients and say, here's how Medicare is changing. Here's how drug plans are changing. Does it make sense for you to switch your supplement? Does it make sense for you to switch to Advantage? Does it make sense for you to switch from Advantage back to a supplement? So we want to be that person and that group of people that work with you long term so that no matter what changes with Medicare, you have a specific person in your corner. And one of my favorite stories is one of my clients, I was helping her out, and she said, just so you know, if anything goes wrong, my husband is 6'8" and he's ex-NYPD. So if there's any problems, you're going to have to answer to him. And I was like, you know where my office is. I'm an open book. I'm not hiding behind a call center. I'm right here in Toms River. And if you got an issue, you can come in and we'll make it happen. So that's what we want to get across to people is like, this isn't a one-time thing. This is a lifelong relationship that we're going to help you out with and make sure no matter what changes, you move, whatever happens, we're going to help you out.
Wow, that's terrific. That's terrific. So you talked about switching between supplement and Advantage Care. When is usually a typical time that happens? Or circumstance?
So the whole supplement versus Advantage conversation is very in-depth, and it depends a lot on where you live, but it comes down to a bunch of different things. It comes down to your health. If you have cancer, dialysis, severe heart issues, I'm going to tend to recommend a supplement because you're going to see, in general, less pushback for big surgeries, for constant doctor's visits, that kind of thing. We talked about the catastrophic out-of-pocket max for certain Medicare Advantage plans being $8,000 or $10,000 a year. Well, if you have a Medicare supplement plus a Plan G, unless something drastic happens, your only out-of-pocket expense is going to be a $240 a year deductible for hospital and medical coverage. So you can ring up $100,000 worth of bills for an open heart surgery, chemotherapy, whatever it might be, and your expense is only going to be $240. So I might say, hey, even though your budget is a little bit tight, we should definitely put you in the supplement because even though it's $150, $200 a month, I'd rather you pay $2,000, $2,500 a year and pretty much prepay your medical bills versus you rolling the dice with an Advantage plan and almost guaranteeing that you're going to pay $10,000. Now, that doesn't always happen. It kind of varies, but there's a little more variability when you go into the Advantage side of things. On the other side, it might say there's a bunch of different classes of Medicare supplements. There's Plan F, there's Plan G, there's Plan N. And what we do is Plan F is a plan that costs a lot of money each month. And it just doesn't make sense monetarily, but a lot of people hold on to it because there's no out-of-pocket cost for hospital and medical. So what we do is we say, okay, you have the plan F, you've never had an out-of-pocket cost, but we can switch you to a plan G if you pass underwriting and your only out-of-pocket cost is $240 a month, but you're saving $800 a year in premiums over the course of a year. Does that make sense?
Mm-hmm.
So you pretty much add one expense, but net, it all ends up on top. So, or people can't afford a plan G anymore. We move them to a plan N and we say, now we're going to introduce copays. And then some people, they come to us and they say, I know I've had the supplement this whole time. It's just not really what I want. Can we do an Advantage plan? And I say, of course, I'll be the person to give you an Advantage plan. You double check, make sure it has all the benefits and stuff that you need. Or people come to us and they say, I have an Advantage plan and I want to switch. But to kind of come back to your initial conversation, most of these happen at the end of the year. So from October 15th to December 7th, there's something called Medicare annual enrollment.
Yes.
And during that period, you can switch from an Advantage plan back to original Medicare, or you can switch from original Medicare to a Medicare Advantage plan, or you can switch your drug plan. So we do a lot of stuff year round, but really that's our Super Bowl. That's our tax season. You got about 2 months to make sure everybody is okay.
Okay.
And regulations change, that kind of thing, but that's where the conversation tends to happen. We'll keep in touch with you all year, but that is where the bulk of any switches are going to happen.
Are there extenuating circumstances where I can switch beyond that time frame?
Yeah, so there's a bunch of different things. There's something called special enrollment periods, and there are dozens of these, but they tend to revolve around major life events. So let's say you lose work insurance. Well, even though it's not the end of the year, you can move from your work insurance to a Medicare plan, or you can start Medicare Part B. So they build in a special enrollment period. There's disaster special enrollment periods where, hey, due to a disaster, you missed your Medicare sign up, but we're going to let you do it the rest of the year. You lose Medicaid, they'll give you a special enrollment period so you can transition to certain parts of Medicare. And there's a lot of different special enrollment periods. They differ depending on a lot of different situations, and what you can do in each situation varies a lot. But it is something to know that if you're going through a major life event of some kind, chances are you can do something related to Medicare. Not everything, but some things.
As you're talking to me and I'm listening to you, I can tell where an elder who don't really have the support or someone that they can confide in or trust to help them navigate these systems and make these decisions, that it can be totally overwhelming where they just sign up for whatever it's that's available or they think that's available to them. Which brings me to the other question, explaining the different options they have, but then once they decide, okay, I think I want XYZ option, then how do they wrap their heads around the different types of health insurance? Because that to me is so overwhelming.
Mm-hmm.
And does a different type of health insurance, is it then associated with the different types of advantage plans that are available? Or does each health insurance have within the health insurance offer these different types of advantage plans? How does that all work?
Yeah, no, it's a great question. So it can be overwhelming. So what we like to do is cut stuff out as we learn what your preference is. So after we talk to you about how Medicare works and we fully educate you on Medicare, you come down to this fork in the road where you basically say, I want original Medicare with a supplement, or I want a Medicare Advantage plan. And there are a lot of different options between those two lanes, but we start off with saying, what's your lane? So if you go with original Medicare plus a supplement, we say, we're not going to talk about Advantage plans anymore. Let's talk about the difference between a plan G, a plan N, what the different companies are, how there isn't a huge difference, if any, between insurance carriers when you have a Medicare supplement. Really, cost is the only thing that factors in. So you cut out the whole Medicare Advantage side. Or you say, well, supplement's not for me. We're only going to talk about Advantage plans. Then we start getting into specifics of, okay, which has the best network for your particular set of doctors? Which one covers your drugs the best? Which one has those extra benefits? and really prioritizing with people what they should actually be focusing on. People might come to us and say, I want a gym membership, I want this, I want that. And we say, hold up, that's all good in theory, but what happens if you're in the hospital? So a lot of times it's resetting what expectations are, what people are looking to get, because your healthcare should be first and foremost in any conversation. But I find if you're looking at like a pyramid of what people are looking to talk about, it's sometimes not the biggest focus, or like it's at the bottom of the totem pole, I should say. They're like, okay, extra perks, gym membership, dental, hospital, and medical. And I'm like, let's flip that and start talking about hospital and medical first, and just say any extra perks are just icing on top. Because, okay, you got a $50 a quarter vitamin benefit over the counter card. That's cool, but it doesn't matter if your doctors all leave the network. So it's really focusing on that healthcare first and foremost, and just resetting expectations and resetting people's priorities in their heads before they make one of the bigger decisions they're going to make in their life.
When, as you're talking, I'm reminded of when we're developing a health education campaign and it's targeted to a specific audience, and in this case will be seniors and elders. Do you do some sort of assessment of their health? So like, because we know that the majority of seniors have comorbid conditions, right? And is that helpful in any way in gauging what options they have while you're doing this, providing this service?
Yeah, absolutely. So we need to know what people's health conditions are to help them make an educated decision.
Okay.
Because I can say, first and foremost, your health is huge when we're talking about drug costs. If you're on brand name medications, if you're on this, if you're on that, your drug costs are going to be very different. So a huge part of just even the drug plan conversation is what drugs are you on? And usually from that drug list, we can get a general idea of what people's health is, but we always double check with people. Hey, have you had any major surgeries? Do you have any major surgeries coming up? Do you have any chronic conditions? Because that really helps people make educated decisions. So for instance, let's say you're on dialysis. You're about to turn 65. Well, when you first turn 65, you can get any Medicare supplement and any Medicare Advantage plan. And this is, I'm talking specifically about New Jersey. It's slightly different in New York, and I'll talk about that in a second. But in New Jersey, you're 65, you're on dialysis. If you have a Medicare supplement plus a Plan G, your dialysis costs will be covered except for a $240 deductible. So those tens of thousands of dollars of bills can be covered in close to full. Medicare Advantage, we talked about, there might be a very big out-of-pocket max. So right away, we're saying, hey, do you want to prepay by paying a little bit more per month to not really deal with any medical bills? But even more than that, when you first turn 65, you can take any Medicare supplement, and you can always take any Medicare Advantage plan. Going forward, you can always move into the Medicare Advantage system, but you can't always move back into a Medicare supplement. You can move back to original Medicare, but any insurance carrier is going to look through your health to decide if you're healthy enough, because they more or less are guaranteed to have to pay your bills. So they're making sure they're going to break even. So that's part of the conversation, is that if you have dialysis and you're 65, I'm saying this is probably your one shot to get a Medicare supplement.
Really? So it's almost like smoking and health insurance.
Exactly.
I'm sorry, life insurance.
Exactly. Yeah. But the thing is, like I said, you have that 6-month window when you first go on Medicare due to turning 65 or retiring or going on disability. You can take just about every Medicare supplement. There's exceptions. I'm speaking very generally, but anytime after that, you might not be able to. And I see the list of underwriting questions every single day. I can tell you with like 90% certainty, this is your one shot to get a supplement. Or,
really?
Maybe you currently have cancer. You have to be cancer free for 2 years to switch back into a supplement. So I'm saying, hey, take this now, because if you take an Advantage plan now, we might be looking at 2, 3, 4 years down the line before you can switch into a supplement. So health is paramount in letting people know what their options are, and just giving people cost estimates too. It's like, I can never tell you to the dollar what it's going to be, but I can say generally, this is covered here, this is covered there. And it really helps people understand, even if they're income insecure, okay, well, this one plan might cost a little bit more, but I'm going to save money in the long run.
Yes. Wow. I never in a million years thought of it that way. And I'm so happy that you brought that up regarding understanding their health condition and then sort of gauging how that is going to help them to determine the type of insurance to choose. The other thing that comes to mind is as you talk about supplement, and I understand that in my first interview with Andy Hum, Andy talked about supplement and the advantages of supplement, it being very helpful for him in different types of health issues he's struggling with. What about folks who cannot afford that? How do we go about dealing with that?
It is a tough thing that we run into, especially as more and more older adults are strapped for cash. We have clients who their Social Security payment might be $1,200, $1,500 a month. Even if they have severe health issues, I say, hey, you're 65 based on your zip code in New Jersey. I can get you a supplement plan N for $100 a month. And they look at me and they say, in all honesty, I cannot afford that. And they have to roll the dice with an Advantage plan because they truly just can't afford that month-to-month cost. Where this goes even further is in certain states like New York and Florida, the cost of a supplement is so high, people feel like they can't afford it, period. There are certain counties in Florida where a Plan G, which might be $130, $150 a month for a 65-year-old in New Jersey, are double that. They're $300 a month. That's on top of what you're paying for Part B with Medicare.
Wow.
So you're talking before we factor in drugs, before we factor in everything, your monthly cost for Medicare could be $500, $600 a month. And your Medicare costs actually scale with your income. So if you're a high earner, it could be even higher. I've actually talked to people who, after we factor in drugs, their all-in cost for Medicare over the course of the year is $10,000 or $12,000 because the drugs are, I think, the biggest gap. I think that's where things can get the most expensive. So it's tough. A lot of people, especially as they get older, maybe you're on a fixed income, maybe you're a widow, you don't have as much money as you would like. And every year when that supplement goes up in price as you get older, it goes from 150 to 160 to 180. Every year it becomes harder and harder to get that supplement. So a lot of people choose Advantage plans because they truly can't afford the option. And I see this a lot in New York is a big example. Supplements in New York are double or triple the price compared to what they are in New Jersey. And that's because New York is a guaranteed issue state. What that means is in New Jersey, when you want to switch supplements outside of when you first go on to Medicare, we talked about you have to go through health questions and underwriting like a life insurance policy. But in New York, they waive those. But because they are just letting people switch wherever and they have to pay their medical bills, the supplements are much more expensive because sicker people are entering the pool and the insurance companies are looking to offset those higher costs. So in a roundabout way, what I'm saying is a lot of people are forced to take Advantage plans because they truly can't afford the supplement. And it's tough because they are saving money month to month, but in the long run, they might have 1 or 2 bad years where they hit that out-of-pocket max and they end up losing money over time. So they really just have to deal with a little more risk, a little more variability. And I keep saying $10,000 out-of-pocket max. I have people who get open heart surgeries on Advantage plans who pay nothing. But I also see instances where people hit that out-of-pocket max or have a denied claim and it sticks with you. So there's just a little more variability involved with those, but it is less money. And just to kind of jump forward into 2025, a lot of health insurance company CEOs have signaled that they are looking to cut benefits in 2025. So Medicare Advantage now makes up over 50% of the market. I believe it's about 51%. And the insurance companies have basically said, we're content with that number. So they've lured all these people in with these benefits like over-the-counter cards, gym memberships, dental, vision, $0 premiums. They might look to in 2025 say, okay, no more gym memberships, no more over-the-counter cards, reduced or eliminated dental and vision benefits. We're not sure the specifics, but the CEO of Aetna today just said, we're going to be making some cuts and we're content with losing 10% of our Medicare Advantage business. So the move looks like Advantage plans are going to be even less advantageous going forward. But like we talked about, a lot of people might not be able to get out of that system due to health questions. So they could switch to original Medicare, but without a supplement, your healthcare bills can be infinite. The supplement is what caps it. So It's a dilemma we deal with every day. I know it's a pretty long-winded answer, but it's tough when you can see people want the supplement, but they just truly can't afford it.
And it brings me to my next question about, do you provide referrals to other services based on your assessment? And I'm sure you probably encounter clients who may have, to be quite frank, overwhelming issues that are beyond the Medicaid or Medicare. And how do you sort of manage that?
Yeah, so we have a lot of people we trust. For instance, we're super thorough about who we recommend to other people. We vet everybody and make sure that our clients are truly getting taken care of. But we have financial planners we work with that we send people to because we truly trust them. It's a company called Retirable. So we've created a referral partnership with them. There is an adult daycare in our plaza. There's a local pharmacy in our plaza, and we recommend people to them whenever it's necessary. We help people with state assistance programs. I know on your website you have PAD, Senior Gold, Lifeline. We help people in terms of what they need to do to get those programs. So it's not so much a referral as just us helping people out and hopefully getting their costs down. You know, we just did a podcast with these amazing company called Senior Planning Services about 15 minutes north of us who help people apply for Medicaid. So it's one of those things where when we find people we truly trust, we will send them there because our scope is only so far. People start asking us about estate planning or Medicare applications, and we're like, it's outside of our realm of expertise. We don't want to give you bad information, but here's what we recommend. Here's where to look. And we can at least point you in the right direction.
Yeah. Thank you for sharing that too, because I know that on your website it has some information as well for funeral services and arrangement of funeral arrangements and estate planning. That would be what you're talking about, right? Or is it different?
So the funeral insurance is slightly different. We've been talking about Medicare, but we do recommend a lot of people get final expense insurance, often known as funeral insurance, because it does long-term help people. Your estate, even the most well-planned estate, can spend a lot of time in probate court. It can spend a lot of time as your family potentially fights over things and someone's left holding the bill. So what we recommend in a lot of cases is this final expense insurance because it allows you to prepay, set it aside 2 to 3 weeks after you pass away. Someone in your family will get a check to help pay for all the expenses. So we don't get into estate planning quite as much. We're actually recording a podcast with an estate planner next week, so I'm excited. But that's one of those things where not only is it not our expertise, we don't want to get in legal liability trouble, not telling people about estate planning when we're not sure of the exact specifics, because it is incredibly complex. It's probably more complex than Medicare, if we're being honest, especially when you get into trying to protect assets from Medicaid, trying to make sure everything gets passed down accordingly. So that is a very big industry, and it's something that we do like to send to trusted partners when we can.
Terrific. And I know that you have a 5.0 star review in Google. So Congratulations on that. And I think there's one thing too, I think from my understanding, I need to get a better understanding of what separates you from other companies. And I'll ask this question. And I believe that the service, you can't be biased in the options or insurance options that you provide to seniors. And how is it such that your business is developed or created that way, if that makes sense? Where you can't be biased. Does that make sense? That question?
Yeah. So kind of going back to the beginning, I think we've grown the way that we do and we have a 5-star rating just because we're radically honest and we really want to help. When you see people, I still remember the first time I had to go to somebody's house and I met this amazing couple, and they had combined between the two of them, they were both quite sick, $60,000 worth of denied claims from a Medicare Advantage plan.
Wow.
So we talk about a $10,000 out-of-pocket max. We don't talk about when the claim is just outright denied. And this wasn't like optional things. This was emergency surgeries. And when something like that happens to you and you're not a total sociopath, you're able to help people and people can genuinely see that you care. When we talk to people, we're talking to people who are getting bombarded with letters and phone calls and commercial ads, and we have to cut through by just being more genuine. When you talk to us, you're our friend. Like, we're not afraid to not only tell you like it is, but people will like curse and they're like, oh my God, I can't believe I said, I'm like, I'm not some customer service person. Like, I'm your friend. You can say what you want to say around me. And the whole unbiased thing, we can't be biased because truly, like, we can't be biased because we're just not allowed to. Our carriers tell us you can't be biased, you can't tell anything. And within our payment structure, I'll tell people straight up, a Medicare Advantage plan in most cases pays me more money. So that's why I can't be biased even in theory, because I would naturally be pushed towards a Medicare Advantage due to the commission structure. That being said, I try to recommend a supplement, and we always try to recommend supplements when it's plausible. But just due to those commission structures, we have to be honest with people and say, we are giving you as unbiased as we can, but we'll tell people the commission structures just so they know where our heads are at. We're like, hey, the Medicare Advantage plan will pay me more, but we recommend this based on your health and everything else.
Yeah. And you got to make a living too. So I think you brought up a very good point, and this is, I know that with the Affordable Care Act when it rolled out years ago, and for coverage for those who are uninsured or underinsured, and that may be different from Medicaid and Medicare. But I want to ask, for that couple that had thousands of dollars in medical bills, and I don't know if this is within the purview of the services you provide, do you help to advocate for them to get coverage to cover that retrospectively, or how does that work?
Yeah, unfortunately, it's very tough to advocate after the fact. Like, I can help call people, I can help call insurance carriers, I can help see. We do that a lot, where our biggest issues are doctors' offices submitting the wrong coding. 9 times out of 10, when a billing issue happens, it's not due to the insurance company. I mean, there are claim denials and that kind of thing, but one of the most common things we see is doctors coding the wrong type of wellness visit with Medicare. There are 3 different types of wellness visits. They all have different codes, and all the time people get denied a wellness visit and they go, what the hell am I paying for? I can't even get a free wellness visit. You can, it just has to be coded properly. And sometimes it leads to a chain reaction where, okay, the wellness visit was denied. Well, now your routine blood work was also denied. And it's kind of something we have to go backwards and get to the source and figure out where in the chain the issue was. But we always say you can't get insurance for things that have already happened. So when someone comes into my office or our office, one of the biggest things I saw in September 2023 was when new people were coming into our office, they had Medicare Advantage plans. They said, I have cancer. I just paid $10,000 in medical bills. What can I do? Unfortunately, nothing. Those bills are there forever. This is the plan that you chose. It is not something you might have been aware about because someone didn't give you the full details. But for us, it's like, okay, you have a Medicare Advantage plan, but I can give you a cancer policy that might be $25 a month or $30 a month that could help pay that $10,000 catastrophic cost. Or you're still healthy enough to switch, maybe it's time for you to go into a Medicare supplement. So these are the conversations we have with people to be proactive, because, we might say, oh, can I retroactively do anything? Unfortunately, the case is no. And I always say, well, you can't get car insurance for a car accident that's already happened. And unfortunately, it's the same thing with our health. If something's happened, you can't switch insurances and expect the new bills to be picked up or anything like that. And to kind of talk about the Medicaid and the ACA, I think it's a big misunderstanding. It is very hard to get Medicaid anywhere. It is the standards for New Jersey. If you're on Medicare, I'm going to be loose with the numbers, but I believe it's $1,300 a month in income and less than $2,000 in assets.
Wow.
To be on Medicaid. Think about how few people qualify for that. I have people in absolute abject poverty who cannot qualify for that. And it's crazy because if your income is $1,200 a month and you can't qualify for the state assistance, $174 a month is going to Medicare. Maybe $100 a month is going for a supplement. You have drug copays. All of a sudden, maybe 25% of your $1,200 is right out the door in medical costs. It's becoming 30, 40, 50% of people's incomes in some cases, and it's just tough to see. So I think a lot of people are like, oh, look at all. The ACA is a little more lenient if you are in poverty. I find that system does have a lot of ups if you're someone on the lower end of the income spectrum. It has a lot of benefits, but once you're on Medicare as well, the game changes and it's a lot harder for you to maintain those income related benefits.
Wow, that is shocking.
And if you ever want to listen to it, our one podcast, we talked to the company. They're awesome people, Senior Planning Services. They talked to us about how to apply for Medicaid when someone needs a long-term care situation in New Jersey. Medicaid requires you to send every single document from every financial institution for the last 5 years.
5 years. Oh, okay. And that brings me to the other question. And I don't know to what degree you may have information or knowledge about this. So say I'm on Medicare and I've had surgery or I need home health care. Does Medicare cover for home health care? And how does that work? Or is it something separate?
In many cases, it is something separate. In most cases.
Really?
One of the biggest misunderstandings is that people think Medicare covers long-term care. It does not. Medicaid does. Medicare might cover the nurses in the long-term care facility. They might cover the doctors in the skilled nursing facility, but there's a limit on how many days you can be in a skilled nursing facility under Medicare. So people learn the hard way that they're already paying X amount of dollars for Medicare just for doctors and hospitals. Then all of a sudden, once you actually need that skilled nursing care, it might be $50,000, $60,000, $70,000 a year for that in-home aide to come to your house, or $100,000 to $150,000 to go to the long-term care facility. So Medicare, in a lot of cases, will cover doctors, hospitals with very little pushback. It's a fantastic program in my eyes. The long-term care system is separate by and large in terms of the room and board and everything like that. So there are some instances where you can get a nurse to come to your house, but it's very rare. I would not plan on Medicare doing that long term for you. This is obviously more Medicaid and estate planning, but people learn the hard way that just 3 to 5 years of long-term care can drain people's inheritances. You might spend $100,000, $150,000 a year per parent to have them at a long-term care facility. And it's not even like as a kid, you're doing a bad job. You truly might not be able to take care of that person. They might need round-the-clock help from nurses, from professionals, but that costs a lot of money. And that is something that's like an entirely separate conversation. It's very hard to let people know, okay, you've been paying for Medicare, but this long-term care is a totally separate and much more expensive conversation.
Wow. This is a lot of information to digest. I really cannot imagine what it's like. Well, I could, because my parents and loved ones have experienced it. And before I got into this, got involved in this in senior care and elder care, and I left them on their own to figure it out.
Yeah.
And, and I think I've mentioned this before. And, I think what happened was with my mother, she switched insurance and there was a delay in her medication renewal of her prescription. And I believe that led to her stroke.
Mm-hmm.
Because there was a
administrative error. Stroke.
What's that?
It's like a clerical administrative error. Stroke.
Yeah. Crazy. Yeah. And that it led to the fragmentation of care. But I think I'm going to close with, this is absolutely incredibly invaluable. And thank you so much for sharing your insight. And can you please share with us, how can we find the services that you provide, with a website, a phone number, an email, as much information as we can give our listeners, please?
Absolutely. So we are based in Toms River, New Jersey. That's our backyard, but we are licensed in 24 different states. So chances are we can help you. But especially if you're in New Jersey, New York, Pennsylvania, these places, that's like really our home backyard. So that's where our office is. If you want to call our office, the number is 848-226-6897. We can link it below. Our website is www.njlifeandhealth.com. And it's and the word, not the ampersand symbol. So njlifeandhealth.com. We're always making educational content for people. So on top of reaching out with us directly, we're always happy to answer questions. We're always happy to do whatever you need. Our brokers are on standby looking to help people. But we have a great YouTube channel where we have a lot of educational information. We keep up on current events. We explain a lot of the concepts we talked about. We also have a podcast called Talking Retirement that Dr. Gunnis was nice enough to be a part of, where we talk to people in adjacent fields from Medicare to help educate people. But I'd say just reach out to us online, call us if you'd like. You could even walk in and see if somebody's available if you'd really want to, or check out all our content, because at our core, we are here to educate people and help people. We've done a lot of pro bono social work. We have done a lot of things to just steer people in the right direction. And I think that's why we're so heavily recommended and been able to grow the business that we do, because in the way that we do, because we just want to look out for you and make sure you're taken care of.
Yeah, fantastic. Fantastic. And just one last question. You do meet clients at their homes as well, if feasible, correct? Or no?
Whenever feasible, we do house calls all the time. I've made some great friends going to people's houses, jamming, playing guitar, hanging out, drinking some coffee. So we do a lot of house calls whenever possible, because obviously certain people can't leave their house. So if that's something where you're mobility impaired, we'd be happy to help you out in that capacity as well.
Terrific. Terrific. Thank you very much.
Thank you, Dr. Gunnis. Always appreciate it.